Did you know that over 30% of adults struggle with sleep disorders? Whether it's insomnia, sleep apnea, or just restless nights, your sleep health matters more than you think. Welcome, where we break down the science of sleep, uncover expert strategies, and help you wake up feeling refreshed every day. Insomnia is a very common sleep disorder, characterized by difficulty falling asleep, frequent waking, or unrestorative sleep. It can have important consequences on physical and mental health, compromising quality of life and increasing the risk of developing other diseases. There are different forms of insomnia. Acute or transient insomnia lasts from a few days to a few weeks and is often related to stressful events, changes in routine, or worries. Chronic insomnia, on the other hand, persists for at least 3 months and occurs at least 3 times a week. This form has a significant impact on quality of life and is often linked to underlying conditions, such as psychological disorders or chronic diseases. Another important distinction is between primary insomnia, which has no apparent medical causes and is often linked to behavioral or psychological factors, and secondary insomnia, which is the result of medical conditions, sleep disorders, or environmental factors. The causes of insomnia are manifold and can be subdivided into psychological, physiological, and behavioral factors. Among the psychological and emotional causes, stress and anxiety play a predominant role. When the mind is overactive with high levels of cortisol, it becomes difficult to relax and fall asleep. Anticipatory anxiety can make things worse, creating a vicious circle where fear of not sleeping causes more insomnia. Depression is also often associated with sleep disorders, as it alters the production of serotonin and melatonin, 2 neurotransmitters essential for circadian rhythm. Another psychological condition that can cause insomnia is post-traumatic stress disorder, which leads to nocturnal awakenings, nightmares, and a general hyperactivation of the nervous system. From a physiological point of view, imbalances in neurotransmitters can promote insomnia. A deficiency of GABA, the main inhibitory neurotransmitter, prevents the brain from relaxing, while an excess of dopamine and norepinephrine keeps the nervous system in a state of alert. Changes in circadian rhythm can also negatively affect sleep. Exposure to artificial light, jet lag, or shift work can alter melatonin production, making it more difficult to fall asleep. Various medical conditions, such as hyperthyroidism, neurological diseases, and obstructive sleep apnea, can interfere with the quality of night rest. Daily habits play a crucial role in the development and maintenance of insomnia. Excessive use of electronic devices before sleep, due to blue light inhibiting melatonin production, can delay falling asleep. Irregular sleep patterns and a negative association between bed and insomnia can create psychological conditioning that makes the problem worse. The diet also has an effect. Excessive consumption of caffeine and nicotine stimulates the central nervous system, while alcohol, although having an initial sedative effect, can break up sleep and reduce its quality. A low magnesium and tryptophan diet can reduce the production of serotonin and melatonin, making it even worse. Environmental factors such as night noise, inadequate temperatures, and uncomfortable mattresses can aggravate the problem. From a biological point of view, insomnia is associated with an overactivation of the central nervous system. People with insomnia show an increase in heart rate, blood pressure, and metabolic activity at night. The sympathetic nervous system, responsible for fight or flight responses, remains active, preventing the relaxation necessary for sleep. The mechanism of sleep homeostasis, which regulates sleep pressure through the accumulation of adenosine during wakefulness, can be altered, reducing the body's ability to feel the need to sleep. In addition, delayed production of melatonin can make it difficult to fall asleep, especially in those exposed to artificial light in the evening hours. The consequences of insomnia go beyond just tiredness. At the cognitive level, lack of sleep reduces concentration, compromises memory, and increases the risk of mistakes and accidents. On the cardiovascular level, chronic insomnia is associated with increased blood pressure, higher inflammation, and a higher risk of developing heart disease. Insomnia also has a significant psychological impact, increasing the risk of anxiety and depression and reducing the ability to manage emotions. At the metabolic level, it can contribute to weight gain and the risk of type 2 diabetes, since it alters the hormones that regulate hunger and insulin resistance. Insomnia is therefore a complex disorder, influenced by a combination of psychological, neurological, environmental, and behavioral factors. In order to deal with it effectively, it is important to identify the underlying causes and adopt targeted strategies. Cognitive behavioral therapy for insomnia, CBTI, is considered the most effective and sustainable long-term treatment, as it helps to change thoughts and habits that contribute to insomnia. Proper sleep hygiene, exposure to natural light during the day, adopting a regular routine and reducing the use of electronic devices before sleeping can significantly improve the quality of rest. In some cases, the use of melatonin may be useful, but it should be taken under medical supervision to avoid imbalances in the circadian rhythm. Better sleep starts with the right knowledge. If you found this video helpful, give it a thumbs up and subscribe for more expert-backed sleep tips. Let me know in the comments, what's your biggest sleep challenge? I'd love to hear from you.